My GP colleagues, like myself, feel that if we could admit patients directly to a ward and they could have some immediate care from a specialist team, that will be much better for our patients. We know that when patients go to ED, because of pressures, they sometimes have to wait considerable periods of time before they get a diagnosis or before they get admitted to a ward and made comfortable. It makes much more sense if we can do appropriate assessments within the community, that those patients go directly for care, and we can then help free up the emergency department to manage those things that it's better at doing. We have talked to the paramedics, we've talked to the ambulance service. They would like to be involved in future plans around that. That would make a lot of sense. They get frustrated at night having to turn up at an ED department and sit in a queue. And if they could get their patients admitted directly to a ward, that would help them. We would like to talk to the wider community, especially around care homes. How do we develop a pathway so that if care home patients need acute attention, they also don't have to call 999 and wait to be taken to the emergency department. If a patient in their 80s feels unwell in the middle of the night and they're in 111, then the out-of-hours GP service will contact them, and if it's appropriate, they will arrange to visit them. They may be able to give them some treatment in the house. They may be able to call in community nurses to follow that up, or they may feel they need admission to hospital. Weston Hospital may well be the right destination for them unless they have some specific conditions that need transportation to Bristol, which has always been the case. But if they need to be admitted to Weston Hospital in the night, then they will be able to convey by ambulance straight to a hospital bed, which will avoid the need for them to spend hours in the emergency department.